start with some praise, some music to get you into the mood, but you know it's time for Ultimate Health on Joy 99.7 FM. Last week we took a bite, literally. And we talked about prevention, management, control of rabies in Ghana. We didn't quite finish that. So today I've got the guest in the studio again. Dr. Emmanuel Peku is with the Veterinary Services Directorate and is a Tema Metropolitan Veterinary Officer. Next to him, Dr. Anita Ago Asari. She's a physician or public health physician with the Kolibu Teaching Hospital. And next to them, I have Moses Osom. He's a senior program officer with the Johns Hopkins University Center for Communication Programs. They are partnering with the Ghana Health Service and the Veterinary Service Directorate to combat rabies in Ghana. If you have any questions, concerns from last week and new ones, share them with us on WhatsApp 055 11 11 997. We're live on Facebook and YouTube. Gentlemen and Madam, you're most welcome.
Thank you.
Right. It's good to get this opportunity to take a second bite at this rabies issue. Let me inform my listeners, home and abroad, that Ultimate Health currently is brought to you by Virtual Security Africa. Virtual Security Africa is a Ghanaian company with over 10 years experience in providing integrated electronic security solutions such as CCTV, access control, intruder alarm, fire alarm, electric fence, and many more. At VSA, they provide cutting-edge solutions to meet security needs of customers with lifetime after-sales support. You can locate them in Accra behind the Life Chapel, Tesano, in Kumasi at Santasi Roundabout, opposite the Goyle Fuel Station, and Takrade Kintampo Road. You can visit them at www.virtualsecurityafrica.com or call them on 0558 740 764 or 0244 215 383. VSA or Virtual Security Africa, bringing you Ultimate Health. So, gentlemen and madam, you're most welcome. Last week we got quite a lot of information, right? Our listeners learned that this is a viral disease, right? And most or the bulk or the chunk of our concern is with regards to dog-mediated rabies and its transmission and the prevention of same. If we could just quickly recap, I learned a lot, but Doc Peku, this is your territory. What were the key things? We learned what it was, right? We understood our concern about dogs and that there's also an ongoing program.
Exactly.
Yeah.
So thank you so much and good afternoon to your cherished listeners. So we want to still educate ourselves and say rabies is still one of the oldest zoonotic diseases that you can talk about. Mm-hmm. And if I say zoonotic, these are the diseases that can move from animals to humans. And we also talked about the fact that this virus, once it enters the body, it targets the central nervous system. Mm-hmm. And because of that, it makes rabies 100% fatal. Once clinical signs set in, there is no point of return. Okay. And we established the fact that when the virus comes into a susceptible animal, whether any mammal, human being, an animal, either dogs, pigs, or whatever, the virus will multiply, get into the brain, and now it comes to the salivary glands where this animal, if the animal bites you, it introduces the virus through the saliva into your body. Okay. So once it comes into your body, it also multiplies. And we said that the incubation period is very variable. It depends on the site of bite, to the amount of virus that is released into your system. Mm-hmm. And 3, we talk about how close it is to the brain. Okay. And we established the fact that once clinical signs, once these signs start showing, so we term the signs alpha. Right. 1, there's a sudden change of behavior. So the A stands for aggression. 2, lethargy. The P is paralysis. the H is hypersalivation or hydrophobia, and then the A is abnormal vocalization, where the animal makes unnecessary noise throughout the whole period.
Okay, great. Now, we learned also that at least globally, 60 to 70,000 people die of rabies every year. And we also established that Ghana is an endemic zone, right? Having established the case fatality, 100 or almost 100%, if you cross the threshold for clinical manifestations, then there's no way back. You established for us quickly last week that where it is confirmed, right, it's a one-way ticket for the dog in question, right? That dog has to be humanely put to death, right? And then there are certain follow-up procedures. But I want you to quickly hit on, you expected, or the program expects, that where there's a bite or where there's a suspicion of rabies, the persons involved should report to the veterinary services department. Can you just hit on that so that we move forward?
Thank you so much. So we are saying that one of the key things to prevent rabies is avoid bites. But if you are bitten by a dog, and probably a dog is confirmed rabies, in fact, we can only confirm rabies when we actually do a laboratory confirmation using the brain of that particular dog.
Okay.
So now, once you do that, we advise that you wash the sites vigorously with water, running water, no less than 15 minutes.
Okay.
And then we also establish the fact that once you do that, please don't stay in your house. Don't go to any pharmacy or anything. Go straight to the nearest hospital. And then concurrently, that bite case has to be investigated. So that is when it's referred to the nearest veterinary office or officer, who now investigates and find out, one, whether there are other contacts, and then two, to also inform the clinician whether he has to take the full post-exposure prophylaxis or probably to take the first three. So these are other things. And then the last one is that once it has been confirmed, and then we have to go into that particular community and ensure that we do a mass vaccination within that community, because there's a possibility that that dog probably had bitten other dogs.
So this mass vaccination you talk about as a downstream response is mandatory on the veterinary services department.
It's
you must.
Yes.
For every case, you must follow up to the community.
Exactly.
And undertake a mass vaccination.
Exactly.
Right.
In fact, the mass vaccination is supposed to be done every year, whether
case or no case.
Yes.
Right.
But however, if we had cases, we still have to go and then still ensure that if there are other contacts, we quickly either revaccinate those dogs, just like we do same for the human beings. And once you do that, you protect the dog population, then you are also able to protect other people that probably came into contact.
Great. If you just joined us, 18 minutes past the hour of 2 on Joy 99.7 FM. We're going into rabies again, understanding prevention and case management and control of rabies in Ghana. My guests are seated. You just heard speaking Dr. Emmanuel Peku of the Tema Veterinary Services Department. Next to him is Dr. Anita Ago, who I go to now, and then I'll also go to a partner or a resource person, Moses Osom, from a partner agency, the Johns Hopkins University Center for Communication Programs. Now, Dr. Ago, clearly, if there's been a scratch or a bite and there's suspicion of rabies, then there must be a report at a health facility. Last week we didn't get to go into this, right?
Yes.
But we dwelt on what the VSD is supposed to do. So I come to you with a suspected rabies scratch or bite or infection. What's the procedure stepwise?
Okay. Thank you so much for inviting us again. So once a patient who has been exposed to a rabid dog, or a dog bite for that matter, comes to the facility, the most important thing or the initial thing that you need to do is to wash the sites copiously with a lot of water that is running, with soap. So running water, soap and running water for 15 minutes. And so that is also done at the facility.
Okay.
I mean, once it's not been done
Right.
already. And then sometimes it's also followed up with some virucidal agents, like agents that can be effective against the viruses, like maybe alcohol or some other antiseptic agents. But it doesn't replace the washing. Let me add that quickly. And then following that, it's important that the patient gets the full complement of the vaccines. That's the rabies vaccines.
Okay.
And it will also depend on whether the dog is confirmed to actually have rabies or not.
Okay.
So like Dr.
Right, just to come in, at this point, you are not aware or you have not received confirmation yet?
Yes.
Okay.
Yes.
So does the administration of the post-exposure prophylaxis, the vaccine you're talking about, does it depend on the confirmation or not?
It depends on it, but you have to start.
You have to
because
start.
it's 100% fatality.
Right.
You have to start. And the incubation period is variable, like he said.
Okay.
It will usually start maybe a month to 3 months, averagely, but some starts very early. For example, some of the sites, if you are bitten on the head, the face, the neck, the arms, and then around the genitals, it moves very quickly to the central nervous system. So you need to start quickly so that once the vaccine gets into the body, antibodies would start at a point to be produced, and then you are protected.
So can we emphatically say to our listeners that as part of the process, you should, or you shall, as the lawyers will say, receive a mandatory post-exposure prophylaxis, right, which is vaccination to start the process.
Yes.
Okay. Whether or not it has been confirmed.
Exactly.
Okay.
Exactly. And I think the window that we would advise you within 48 hours, you must have started. Up to about 72 hours, you must have started. So that you can have a good chance of fighting off the rabies virus if it's actually entered into your body.
Right.
So that's usually the window that we give. So once you come, if it's going to be confirmed, or if the dog is confirmed to have rabies, then you are going for the full course, usually 5 days, depending on the manufacturer, 4 or 5 days. Over the whole month, so up to 28 days. If it's not confirmed, or it's confirmed not to have rabies, that's the dog, then you would have, you observe the dog for about 10 to 14 days. So you'd have taken the first, the third, and then the 7-day doses. So you would have taken 3 doses of the vaccine already by the time the dog is confirmed not to have rabies. So sometimes, depending on the situation, you may be also given some immunoglobulins, which also help. There are antibodies already formed that help to fight the rabies. But then the vaccine is the core or the cornerstone for the post-exposure prophylaxis.
Right.
Yes.
If you've just joined us, it's 23 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living, brought to you by Virtual Security Africa. You can visit them, www.virtualsecurityafrica.com, or call them on 0558 740 764. We're talking about rabies. Indeed, I have rabies in the studio as a topic, right? Not the virus, okay? And we're breaking it down so you understand. It is 100% fatal, right? And we are in an endemic region. Ghana is an endemic zone. There are efforts, partnerships, interventions, management strategies, communication strategies underway on a regular, should I say, all-round or year-round basis. Okay, we're going into that so that you understand what is done. You also understand your part of the bargain, right? Your role, right? Last week we learned that you're supposed to look after your pets. Okay, some people handle their pets as if they are strays, even though they come home to sleep, right? We learned that in other jurisdictions you are a licensed pet owner, right? And that pet is known to the system. And these are all things that we need to educate ourselves on, our role, our obligations. We also learned, quite frightening, that some of the people who come to your house, these ambulatory veterinary officers, with all sorts of things they take from their pouches, their waistbands, and other places, and jab your dogs. Sometimes these are not safe. And you shouldn't, should I say, put your guarantee or your safety in those, especially if there's a break in the cold chain of vaccines and so on and so forth. Questions are welcome. WhatsApp 055 11 11 997. Okay, so we've gotten to this point. All of this also depends on, or is premised on good communication. You said if the dog is confirmed, we may not have the dog.
Yes.
Right?
Yes.
So I'll come back to you as a clinician. We don't have the dog, right? We have a suspected rabies infection, right? You still do these things, yes, right? Maybe along the algorithm, something will change, okay? But let me just come back to the campaign. We know we have a bigger chance of preventing rabies and preventing its transmission. So a lot of the emphasis is on making sure that dogs, the key end hosts, are vaccinated, right? And then also education to prevent dog bites and therefore effectively prevent transmission. Now, I know there are partnerships going on, and let me introduce Mark into the discussion, right? Johns Hopkins, I'm always tempted to say John Hopkins. It sounds better, but Johns Hopkins is a partner agency, and it's partnering the Ghana Health Service and the Veterinary Service Directorate to create awareness and run some of these intervention programs. What exactly are you doing?
Thank you very much, and we really appreciate this opportunity. Good afternoon to all your listeners.
Yeah.
Let me quickly say that my first name is Mark.
Mark.
So it is Mark Osom.
Mark Osom.
Yes. So
did I change it at a point?
Yes, that's okay.
Okay. Mark.
Yes.
Mark.
So it's not Moses. It's Mark Osom.
All right.
Yes. So
okay.
Breakthrough Action is the flagship SBC program, Social Behavior Change Program, and it is led by Johns Hopkins Center for Communication Programs.
Okay.
In fact, so we have Breakthrough Action across many African countries, but in Ghana, we work closely with the Ghana Health Service, Ghana Education Service, and then all One Health partners, including veterinary services.
Okay.
The rabies intervention is being implemented in 4 regions and 20 districts. Okay. And in addition to what we are doing today, there are other aspects of the support.
Okay.
One is risk communication and community engagement, making sure that we have a vibrant risk communication subcommittee at the regional level to coordinate risk communication.
When you say risk communication, I know we did all this when we had COVID, right? But what exactly is risk? Let my listeners understand so that it's not too programmatic and maybe abstract to them. What are you doing when you're doing risk communication? Is it the same as awareness creation?
Exactly. So
okay.
It's the same as awareness creation, but when we say risk communication, we are talking about making sure you are exchanging real-time information from an expert or an official to the people that need the information.
Okay.
So when there was COVID, we had people at the Ghana Health Service level making sure that they disseminate real-time information to our community level so that they are well informed to take
all right, so that should be an ongoing program. Let me just also give real-time information to my listeners from my sponsors. We'll come back in a second. Stick and stay.
Virtual Security Africa is your #1 provider of a complete integrated electronic security solutions and services in Ghana and Africa. Trust me, from CCTV surveillance, access control systems, intruder and panic alarms, fire alarm systems, physical security and inspection systems such as X-ray scanners, vehicle boom barriers, road blockers, etc. And they even have public address and intercom systems and many other facilities for your homes, offices, and even large enterprises. VSA offers a lifetime after-sales support. Call VSA today on 0548 740 764 or visit their showroom at Nana Adepa Plaza, Jolu, opposite the UBA, or visit their website at www.virtualsecurityafrica.com. Virtual Security Africa, complete security solutions.
Welcome back to the studio. Ultimate Health on Joy 99.7 FM, brought to you by Virtual Security Africa. We're talking about rabies. Any questions, concerns, share them with us. WhatsApp 055 11 11 997. We're live on Facebook and YouTube. Before the commercial, I was speaking to Mark Osom on the partnership, right? And we just explained what risk communication is. What else are you doing?
To launch rabies campaign, and that is going to happen next week, July 13th.
You are going to launch the campaign?
Yes, rabies prevention and control campaign here in the Greater Accra region.
Okay.
And that is going to happen in Lankwantanan Medina municipality.
Okay.
So there are three main objectives. One is to raise awareness of the disease, and then also make sure that community members know exactly what to do to prevent exposure to rabies.
Okay.
We also want to make sure that we strengthen collaboration among all One Health partners in the fight against the disease.
Okay.
And thirdly, also to promote responsible pet ownership. It is important that pet owners vaccinate their dogs on a yearly basis, just as Dr. Peku mentioned.
Right.
So the campaign is going to involve traditional leaders. We're also going to have some school children come on board to do a role play to let people know what basic actions they can take to prevent rabies.
Okay.
And of course, there's going to be a vaccination exercise. And so we are inviting all pet owners to come along with their pets, cats, dogs, to come get them vaccinated to prevent rabies.
So at these activations, are you expecting that whilst you're giving the information, whilst you have specialized or qualified resource persons giving information, alongside it you're saying I should bring my pet for vaccination on the same site, on the same event? What exactly are we saying?
So yes, on the same event we are inviting people to come along with their pets, but as part of the event there's going to be other activities post the event through community engagement.
Okay.
And so again, with the community engagement we are working with the veterinary services so that as we move into the communities, meet the community members, we are able to vaccinate those who come along with their dogs.
Okay.
So the vaccination is not going to be done only during the event, but post the event, we're going to continue the vaccination exercise in the communities. Okie
dokie. 32 minutes past the hour of 2 on Joy 99.7 FM. We're talking about rabies and the rabies campaign. One of which is going to be launched, next week?
Next week, July 13th.
Right.
At the Medina Zongo Junction, Libya Quarters.
Okay, Libya Quarters.
Yes.
Okay, so that is not a district or a local government. Is that a local government location?
Lankwantanan municipality is one of the districts in the Greater Accra region.
Okay.
And Libya Quarters is behind the Zongo Junction. There is a very vast park there.
Okay, so it's a public space.
Exactly.
Kind of.
Yes.
Okay, all right. So that's the information out there. We're also going to be talking a bit more in detail about the clinical features once a human being gets rabies. We're told by our specialist in the studio that it is 100% fatal. If you start to show the signs and symptoms, there's really no going back. Anything they'll be doing for you will probably be palliative, right? Making you comfortable, but it's almost 100% assured that you will not make it. That's why prevention is key. Dr. Agua-Asare, let me come back to you. Let me read this from Dede. Should the animal that bit you run away and can't be found, do they immediately start the rabies care? We've talked about that already. This is from Dede in Maryland. Dede, thanks. Hi, good afternoon. Thanks for the program. How do we deal with stray dogs in our communities, right? It's something I'm going to hit on with Dr. Peku. In most civilized countries and communities, you can't have strays. They'll come catch them, right? Whether they are edible or not, right? They'll come take them away, okay? And that includes those that are not licensed as well. Yeah. So that's a good question from Akosia in OEB. This one says, good afternoon, Ni. Please, may we know how long a dog infected with rabies will live before it dies? They talked about the incubation and the manifestation of symptoms being variable, but I think Dr. Peku will touch on that again. Right. So, Doc Agua-Asare, let me come back to you, Anita. Okay. So, we've got a person in front of you, suspected you've started the post-exposure prophylaxis.
Yes.
All right? So, is that on outpatient basis? Is the person admitted? What do you do with such a person?
Okay, usually it's on outpatient basis. So
Okay.
the patient comes in daily when they are scheduled to have the next dose of the vaccine, and then they go.
Okay.
However, sometimes due to the extent of the bites, you may need to keep the patient inpatient for a while.
Okay.
And then manage them a bit before you send them home. But usually it's on an outpatient
basis. Okay. Right. So you would get the treatment, the vaccination, and all that.
Yes.
Samples that need to have been taken will be taken from you, the human, or
Yes.
are they animal samples that are required for the investigation and the confirmation of diagnosis?
Usually, it's the animal confirmation that would help you to know. Like Dr. Peku mentioned, because the virus usually stays within the central nervous system until you get the brain of the infected person.
Okay.
Whether animal or human being, you can't really diagnose it.
Right.
There are some blood tests that are done, but usually because the virus would not go into the blood during the time that the patient is showing the symptoms, I mean, they don't really give much information.
So conclusive diagnosis is almost always post-mortem.
Almost always. However, there are some other tests that you can use, the cells from the nape of the neck, and then all that. But then for sensitivity, when the test is very sensitive, then it's the one that you are taking from the brain. So you are very sure that this is indeed rabies. So in saying that, I mean, in another way, it's like if you take the sample from anywhere else, you are not sure that what you are getting is really the true reflection of the state. So you don't know whether your negative test is really negative or not until you get the brain. Yes.
Right. Okay. I'll come back to you for the cause of the disease, of course, because in the human being, just like the animal host, it will go through incubation, then you start to get certain changes taking place. We'll talk about those in a bit. But let me come back to Dr. Peku. Dede is asking again, can you get rabies from eating a rabid animal? She asked last week. It was answered, right? You suggested or you educated us that if it's gone through the processes of cooking and all that, the virus is not active or it's killed. But persons can get it from handling the meat of a rabid animal.
Exactly. So there have been recorded cases where people that have butchered dogs that are positive for rabies have died. So what we are saying is that the process of preparing the meat, you can contaminate yourself. You know, the danger is that once probably you expose yourself to probably the brain or other tissues, it could be the saliva. If you have a broken skin, the virus can penetrate and then it will start the multiplication.
Right. So you can't get it at least through consuming the meat that has been cooked.
Yes.
Well cooked.
So once the meat is cooked.
Right. Okay. So these were answered last time. Why is the emphasis being placed on pets? There are rabid animals out there that are not pets.
So if you look at the documented case, like we said, 99% of all human-mediated rabies is mostly transmitted by dogs. However, we are saying that every mammal is susceptible. So you can have goats, monkeys, and all that. They are what we term the end host, because you can attest to it that hardly will you see maybe a goat or probably a cattle moving in the street from house to house trying to bite people. So most of the time when they get it, they get mostly the paralytic form, though we have cases where you have the ferrous form affecting these livestock, but most of the time they actually probably transmit it to the people around them.
So the focus on dogs or canines is evidence-based.
Exactly. So you see that dogs are mostly the ones that when they move from place to place, biting other dogs, biting people, and all that. So that is why.
So that's why we're focusing on pets.
Yes, and it's been documented that almost 99% of cases are transmitted by dogs.
Good. Stray animals. What do you do? What's your role? That must be an area of concern. Is that part of the campaign, part of the program?
So it's a very big challenge with free roaming and straying animals in the country. And I always say that this approach, I always hammer that it's a multi-sectorial. We need the environmental health people. We need the district assemblies to enact laws that will help to bind people from allowing their animals to go out and all that. And in fact, we have these laws in the assembly, but it's just the enforcement that becomes a problem. So as part of the campaign, as we said, we are doing public education.
Are you the agency supposed to enforce it?
No, so we if you look at our mandate, we ensure that these animals are vaccinated. So you come to the environmental health and the local assembly, they enforce.
They are
those laws
supposed
to enforce.
rid the streets, the communities of stray animals.
Yeah.
And you're saying they don't do that.
Yeah. So yes. So these are things that we are bringing up, that these things have to be taken care of. However, you have people have different mindsets when it comes to straying animals. One, what I'm saying is that all these animals that are straying have owners. So if people are responsible, they won't allow their animals to move about.
Mm-hmm.
However, if these animals are even vaccinated, it goes a long way to protect the masses. But all that we are saying is that the assemblies, all these stakeholders have to have to rise to be able to enforce these laws, to be able to deter people from allowing their animals.
So what I'm trying to find out, you have one of your partners, key partners here, right? When he talks about stakeholders, risk communication and all that, are these other agencies and state structures part of this campaign? I can understand you doing role plays with school children, educating pet owners, and so on and so forth. Are these people roped into this program, or are they doing their own thing anyhow?
No. So as they are going to the assembly, in fact, the local assembly is part of it. You have all the maybe NCC and all these partners. The local assembly, in fact, they are all part. If you come to the districts where we have the public health emergency committees and all that, it involves all these people. I
don't like hearing the committees because, I don't like saying it, but I've done this program for what? 20 something odd years, right?
Yeah.
Since 2003. So this is not the first time we're doing rabies or any other community intervention, right? And local government has been there.
Yeah.
And I'm hearing you say that there are no people are having different mind when it comes to stray animals. The law doesn't allow us to have different minds.
Yeah.
In my opinion.
Yeah.
Right? So which part of this is going to make it so urgent and priority for these agencies to do their work and enforce the law and ultimately protect all of us and reduce the numbers?
Exactly. So that is why this opportunity is a very great opportunity for us.
Can't you inject some of them with rabies?
So it's something that we really have to look at it holistically, because at the end of the day, we do our part. The assemblies also do. If all of us are doing
essentially what I'm
part,
saying is that your part is irrelevant.
Yeah.
It's a key link in a chain of protection. So 1 week link, if Dr. Ago Asari at Kolebu or wherever, any other doctor is not doing their part, right? If your partners, NGO or donor partners, are not doing their part, do you see? I would have loved it if there was no foreign partnership needed, but unfortunately we need it. Do you see? So this is where my frustration is, okay? I'm getting into the aggressive phase, right? And not lethargic. But what is it that is in this program? My listeners will understand that, yes, okay, let me take my dog, let me get the education, right? School kids will learn. But if the enforcement is not there, and last week, remember, critically we established that the handling of appropriation and resources to support these programs has become a local government roulette or musical chairs where you are starved of the funds. That is the point I'm making. Are they a critical pillar in this, or are we doing our awareness on the side of the public and so on, who I guess are more pliable?
Yeah, so we also have to rely on these people, the assembly and other agencies to support.
Okay.
So because if we don't have the logistics, we cannot move.
Okay.
So I think that it all boils up to educating the people to know the dangers of what is within our community.
Okay.
Because if people know about rabies, I always say this thing. If we are able to talk about rabies, just even 1/3 of how even we talked about COVID, I believe that the mindsets of people will change, and you have all these stakeholders coming into play to support. However, in our part of the country, when it comes to animal things, people have a different conception about it. or perspective about how we deal with our animal issues in this country. And I must say that it's about time for us to know that these animals have Ghanaians, and now we are all having different lifestyles where we are having dogs in every home in the country. And if we don't have it, if we don't change our mindsets about these things, I believe that it will go a long way to affect us.
Okay. All right, 45 minutes past the hour of 2 on Joy 99.7. Don't mind me if I get a bit, right? Sometimes I feel Ghanaians are just not angry enough about anything, right? We're talking about rabies, and there are challenges, and there's a campaign being launched. We've been given the key salient pillars of the campaign, right? Risk communication, learn how to manage and look after your pets, right? How to avoid and prevent bites. Make sure your pets are vaccinated. All these are part of it. We are sadly hearing that there are some structures in the system that perhaps are not pulling their weight. Mark, let me come back to you, right? Okay. There's a program, there's support for a program which rightly should be undertaken by an agency, and you are supporting the agency and the Ghana Health Service. Okay, this is great, right? But what's your take on this aspect of it where, okay, people will call in, and my phone lines, please let me activate them. 0302216541. 0302216541. You can call in and ask the questions yourself, or WhatsApp is 055 11 11 997. This is Ultimate Health on Joy 99.7. So, I mean, if you do all this, and he says people's attitude to pets and animals and so on starts to change, but they don't see, should I say, a related change in enforcement. Somebody brings their cows, they move around, they mess up the streets, they do this and so on and so forth. Doesn't that undermine the program, even though we know the key or salient mode of transmission? Doesn't that undermine the program?
Yes, of course, that will undermine the program. But let me say that we are doing this all under the umbrella of the One Health concept, which I know Dr. Beku talked about last week.
I totally understand that.
And you concept. Know, the One Health concept is a new idea. And so gradually we are very hopeful that
it's not that new. With all due respect, it is not that new, and we are heading towards zero rabies infections by 2030.
Exactly.
I have the concept papers. It's not that new.
Yes.
Right. But we each time tell people we're starting something. So I'm trying to say this One Health. Look, years ago, we had what was the slogan then? When I was doing national service, Health for All 2000. Right? Yeah. I'm sitting here, we're in 2023. Yeah. There was a campaign called Health for All 2000. Yeah. Okay? So I understand those things, but I'm saying, so a partner perhaps would not want to get very agitated with local government structures. But if it's an impediment to the target and its attainment, is it featured in these things, or are we going to have committees and subcommittees? And
not really. And let me also continue by saying that leadership in this regard is very key. So when we had the risk communication meeting in one of the districts we are supporting, specifically in the Upper East region, Kasana and Kanan, the municipal chief executive immediately after the program made sure that they included this rabies prevention and control into the assembly sitting. Right. And as part of that agenda, they agreed to make sure that they start enforcing the bylaw to make sure that people who have dogs and they have left them to move around begin to look for their dogs and keep the dogs in their home. So I think that for behavior change, it takes time. It is a process, and we are hoping that as we move on, I mean, people will come to that realization that they need to take some of these things seriously.
Okay.
Yeah.
All right. 49 minutes past the hour of 2 on Joy 99.7 FM. We're discussing the prevention, management, and control of rabies in Ghana. There's an upcoming program to be launched in Medina, right? To educate you on how to look after your pets, what to do with regard to prevention of bites, and also to make sure that you vaccinate your pets, your animals, and specific emphasis on dogs. But that will be available at various centers. There's a program you're supporting. I think, is it Ashanti?
So we are here in the Greater Accra region. I am Ashanti region, Upper East region, and Western
Upper
region.
East and Western.
Yes.
Can you explain to my listeners, since we say, and Dr. Peku also says this is a nationwide problem, are these pilot programs, or are they selected because they are hotspots or they have high number of cases? Is there a basis?
Yes, so of course, rabies is a very dangerous disease, and we wish we could have supported all 16 regions with this intervention. But working with our One Health partners, the veterinary services, the data we gathered indicated that if we have support, then we should focus on these 4 regions. And let me add that in each of these regions, we are supporting 5 districts. So overall, we are doing this in the 20 districts and 5 and 4 regions.
Okay.
Yeah.
All right. Okay.
So it is about what the data is saying at the moment, even though rabies is, even if it is one case, it is something that is worth...
It is data-led. Okay.
Exactly.
Right. If you just joined us, my phone line is active 0302-216-541. Ultimate Health on Joy 99.7 FM. Brought to you by Virtual Security Africa. Visit them on www.virtualsecurityafrica.com or call them on 055-8-740-764.
Virtual Security Africa is your number 1 provider of a complete integrated electronic security solutions and services in Ghana and Africa. Trust me, from CCTV surveillance, access control systems, intruder and panic alarms, fire alarm systems, physical security and inspection systems such as X-ray scanners, vehicle boom barriers, road blockers, etc. And they even have public address and intercom systems and many other facilities for your homes, offices, and even large enterprises. VSA offers a lifetime after-sales support. Call VSA today on 0548-740-764 or visit their showroom at Nana Adepa Plaza, Jolu, opposite the UBA, or visit their website at www.virtualsecurityafrica.com. Virtual Security Africa, complete security solutions.
Joy 99.7 FM.
That's right, Ultimate Health brought to you by Virtual Security Africa, a Ghanaian company with over 10 years experience in providing integrated electronic security solutions such as CCTV, access control, intruder alarm, fire alarm, electric fences, and many more. At VSA, we provide cutting-edge solutions to meet the security needs of our customers with lifetime after-sales support. Locate us in Accra behind Alive Chapel in Tessanon, Kumasi Santasi roundabout opposite the Goyle Fuel Station, and Takrady Quintampo Road. Visit us at www.virtualsecurityafrica.com or call us on 055-8-740-764. Coming back into the studio, and my phone lines are active, but Dr. Aguasari, so we have some of these cases, as we said, of course, they should proceed to the hospital.
Yes.
When it gets to the critical stages, are they still managed as outpatients?
No. Actually, when it gets to the critical stages, you see that the patient is either paralytic, like Dr. Peku said.
I should have added critical, how should I say it? Confirmed cases.
Yes.
Right,
yes.
okay.
So they are either paralytic or they are aggressive to the extent that you can't keep them at home.
Okay.
So at the end stage, they usually end up at the facility where they are managed until they pass away. So at that stage, you can't keep them at home.
Okay. With the animals, they go into quarantine, right? They are observed, and then what needs to be done for them. So the human being, I suppose, will also be in some form of quarantine.
Yes. So they usually keep them. So at Kolebu, you'd find them at the infectious disease units of the facility where they are kind of isolated till they are managed till the end.
Wow.
Yeah.
So that would entail a lot of stuff because, of course, if it's a terminal condition, then you're managing family members and so on and so forth.
Exactly.
With regard to the animal case, the VSD was mandated to go to the community and do a mass vaccination, of animals.
Yes.
And we've heard and learned that we have more availability when it comes to the animal vaccines than the human vaccines. What is the, should I say, associated program for the human case? So this person now is terminal, We've quarantined them. Okay. What about their family and other people? Are you going to do anything for them?
Yes. So together with the veterinary services, because they go back into the community, you can't disaggregate these processes.
Okay.
So they do the contact tracing. So they help with identifying the human cases that are contacts, including the family members.
Right.
Of course, if the patient comes to you, you would also know who the family members are. And then depending on the risk assessment, you'd have to also protect these family members with the post-exposure prophylaxis if needed. Yes.
Okay. Right. I have a call on the line. Hello, good afternoon.
Yeah, good afternoon, sir. I'm calling from Tama. I'm Bismarck.
Bismarck. Okay, go ahead, Bismarck.
Yeah, please, when you activate the phone, please, when you call, you try and pick us. Sometimes you call, then they will not pick us. So let me go straight to my point.
Go ahead.
My question is, you see, rabies is very serious. It's a bad disease. And sometimes you see dogs in town, especially this big dog, this bulldogs in town. Sometime a couple of weeks ago, I was going somewhere, and you see one of these bulldogs, the chain leave for the neck, and they only have to run for the dog. And it is very dangerous. And what the authorities are doing to ensure that these bulldogs are kept in their home. And you see some of the guys holding this evening time, night time in the town as if it's a common thing. And for me, it's a very bad thing. So the authorities have to ensure that this thing has been stopped once in a while. You have to keep dogs in your home. When you come to the locality I stay, you see a lot of dogs roaming. These dogs are not vaccinated, and they are in town. We have kids in town. So please come with a policy that will ensure that these things have been stopped. Thank you.
Okay, Bismarck, hold on. Don't run away. Are you there?
Yeah, I'm there.
The first part of your submission is to do with people walking their dogs, irrespective of the breed of the dog, right?
Yes, sir.
And you have a concern about that. People walking their dogs on a leash, right? So you have a concern about that one as well. Am I right?
Yeah.
And then you are talking about stray dogs as well.
Yeah.
Okay, right. Well understood. Thank you, Bismarck. Okay,
thank you.
Right. Okay. So he's expressing his concern that, people move around, and if you have the money, you can feed your dog and it looks like a lion, right? But these typically would tend to be well looked after and vaccinated pets, though they don't look friendly, right? But he's also bringing back the question of strays.
Yeah. So I think, I agree with him. But what I want to add is that when people are probably walking their dogs and all that, they should know that dogs also need exercise. Right. One, we should know that dogs are a very good companion for security and for all that. So we shouldn't see it as a threat. However, if these dogs are not vaccinated, that is when there's a threat.
All right.
Or when they allow them to roam. So the second part. So all that we are saying is that, yes, we have dogs that are moving around and all that. But we are advocating that let's ensure that our dogs are vaccinated every year. And then whilst we do that, we are also telling our partners, the assembly, the environmental health, to also ensure that these laws are enforced.
Okay.
Because
you're saying it so nicely.
Yes. What I'm you're
not frustrated at all. Your job must be frustrating.
Yeah.
Now, when you say you want to enforce, okay, let me leave the stray ones out for you in this program.
Yeah.
But with regard to, let's say, dogs being vaccinated, is there any aspect that involves going house to house and checking the vaccination status of dogs or pets?
Yeah, so when we vaccinate, we issue a certificate that is valid for one year. So as part of it, when you go and a dog is vaccinated, they will produce a certificate that will show that the dog is vaccinated. But I think that we have to do more of the education, because when people are aware, I believe that they will do everything they can.
I specialize in behavior.
Yeah.
I'm a clinical psychologist.
Yeah.
Right? And I want to disagree with you that behavior change, of course, there's motivation, there's incentive, right? But there's also the carrot and the stick. If an officer is coming around, whether it is my refuge, which is all over the place, or my dog, or my chickens, or whatever, my goats that make noise, or whatever, there must be a related measure the communities and the countries we admire